Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us.
Welcome back. My next guest is another one of my colleagues at Family Practice Associates, Dr. Alicia Farmer. Welcome.
Hi.
Now, I said women's health. That encompasses a lot of stuff.
Certainly does.
But January happens to be Cervical Awareness Month and cervical cancer, so that brings us to pap smears. Who should get one and what are you looking for?
So pap smears should start at age 21. And when you begin getting your pap smears, you first start with just getting the procedure done, and then they take it to the pathologist to do the cytology, looking for abnormal cells. And you should do that every 3 years, as long as it's normal. By age 29, then you can go into also adding the co-testing for HPV. And that then from 30 to 65, you will get that along with the cytology. And if that is normal, you can do it every 5 years.
Okay, now you mentioned HPV and you're looking for cervical cancer, but there's ways to prevent that.
Yes.
In addition to doing your pap smear, there's some immunizations?
Yes, so Gardasil has been around since 2006, and it is not really about being a vaccination for an infection, it's about cancer prevention. So currently Gardasil is a 9-valent immunization that covers 9 different types of HPV viruses that cause infections and certain types of cancers. That can be cervical, vulvar, anal, and then throat cancer. And by getting that starting at age 11 to 12, both boys and girls, up to age 26, that actually prevents cancers as well as those infections by 88%.
Now I want to underline something you said, boys and girls, because when we first started out we were focused more on girls than
yes.
boys.
Well, all children and then young adults who become sexually active can get infected by this HIV virus. It's actually 85% in their lifetime.
So, switch gears to another health issue for women. More than men, but men also, is osteoporosis.
Yes.
Explain the difference, or what is osteoporosis? We hear osteoporosis, osteoarthritis, there's a difference.
There is a difference. And the biggest difference is osteoarthritis is like the wear and tear of your bone. It's like your shock absorbers of your car just kind of thinning out and breaking down. But osteoporosis is actually losing bone mass. And then you actually have irregular turnover, which is building new bone and replacing old bone, and you have brittle, fragile bone.
So how do you know if you have osteoporosis?
So what you usually start at the time of menopause is starting to look at risk factors of women, mainly because at the time of menopause they can have 1 to 2% bone loss. Now menopause can last up to 10 years, so that could be a good 10 to 12% loss in their time as they transition through that time. So at least by age 60 then is when they should start getting their first DEXA scan.
So is there things to do to prevent?
There is what we call bone healthy lifestyle, and that is not smoking, moderate alcohol intake, weight-bearing exercises, and especially through the menopause, the studies are saying getting resistance training in to protect those muscles and bones. A good sources of daily calcium in your diet, and then vitamin D supplements have been looked at and should be given to anybody, men or women, over the age of 65.
And also, if you have osteoporosis, there are therapeutic medications.
There's 4 therapeutic medications that look at both treating vertebral and hip fractures. Hip fractures being the sentinel fracture that causes the most mortality and morbidity. It can cost actually billions of dollars, up to 2.5 million office visits a year and 400,000 hospital visits.
Okay, as part of that conversation, you used the term menopause. So, if you're menopausal, briefly, hormones, good or bad?
So, you know, there's been a lot of controversy about that, especially with the Women's Health Initiative study that came out now almost 20 years, 15, 20 years ago. But bottom line is if you are starting to have menopausal symptoms and you start hormone replacement therapy within that first 5 years of menopause, then hormones are safe. As long as you've not had a heart attack or you've had blood clots or any other history of blood disorders.
Well, that's great information. There's a lot more stuff about women's health. Maybe we'll have to have you back again to do it again. All right.
Thanks.
Thanks for coming in. We'll be right back.